Very good morning, ladies and gentlemen. It's my profound honor and the pleasure to be here, and I convey my great thanks to Forbes and PureHealth to allow me to speak at this summit. Today, allow me to speak to you about building healthcare community and how is the vision of United Arab Emirates, my beautiful country, to enhance and support the excellence, innovation, technology at the healthcare services. We, UAE 2023, it's a vision of the federal government of United Arab Emirates with collaboration with different local governments. This is an initiative which was announced a couple of years back, that by 2023, we will be reaching the highest standard, if I will speak, in healthcare services. One of the main pillars of the UAE 2031 is an innovative state-of-art healthcare services, and it has mainly three main pillars. The first is high-quality healthcare services available to everyone, accessible, affordable, to be provided to each single person who lives in this beautiful country, the United Arab Emirates. The second pillar is the future-ready healthcare system, which it means the high technology, the most innovative technologies, which it will be presented, and it is being presented by different stakeholders here in the UAE. And whenever I say our stakeholders, includes governmental and the private hospital together, because we consider the private sector as the most strategic partner to the government. And they are competing each other's, and such competition between the government and the private will lead to the increase and enforcement of healthcare quality of services. And therefore, exploring the new technologies, genome technology, and different technologies to be introduced in our healthcare services. And the third pillar is the global destination for specialized care, and mainly concentrating on the medical tourism, which the medical tourism, it became a part of the major request and the demand in the government of United Arab Emirates, and mainly in the Emirates of Abu Dhabi and Dubai. This initiative has been taken from the definition of the health by the WHO. This definition has been defined that health is a state of complete physical, mental, social well-being, and not merely absence of disease or infirmity. And therefore, this has been taken into consideration by the government of United Arab Emirates. That's to make sure that we will be going aligned with the international guidelines, and we work as an ecosystem in the UAE. And to work as an ecosystem is very comprehensive collaboration between different stakeholders. And such collaboration enhanced the ecosystem of health in the UAE, not even at the second circle that we have all the stakeholders, such as Ministry of Health and Prevention, local authorities, military, the defense, including the private sector, that we have a strong belief in the private sector to be a part of a major player in providing the healthcare services, not even in providing, but also in decision making. And therefore, it has been established for the last 15 years, Emirates Medical Council. The Emirates Medical Council is chaired by His Excellency, the Minister of Health, and consists of all the stakeholders, includes 3 members from the private sector. And we work all together to design the regulations, the systems, the policies in the UAE, that it goes aligned with the need and the requirement of different stakeholders, including private and the government with the military. And we did not forget the community, the public, the parents, the patients, and also the youth, what they do think of the future of health in United Arab Emirates, and how we will be able to design the health of the UAE for Centennium 2071, which at that year we will be completing 100 years of prosperity and success. And as an ecosystem, we do manage very strongly with the international organizations such as United Nations, the World Health Organization, the Arab League, and the GCC. And the PPP, private-public partnership, it became a main player to support our projects and our initiatives in designing our future. And this led us to have different type of policies. And those policies is to support the human health and to define where we do stand, where we are going, and how to predict and to prevent different type of diseases at the level of the country. And those policies, as an example, has been given here, which was designed as a holistic health promotion with all the stakeholders in the UAE, such as National Program for Happiness and Wellbeing, National Health and Wellbeing Policy, National Policy for Promotion of Women's Health, and National Policy for Promotion of the Mental Health, which is very important, and a National Policy for Promotion of Healthy Lifestyle. This is being designed and implemented in the UAE. Now, the final one, which is in green, is the national survey, which is undergoing by the all health authorities at the level of the country, including the private sector and also the concerned ministries and local governments, is the National Survey for Health and Nutrition. And this national survey for sure will define that as where we do stand in NCDs and what we has to be done in even the genetics and different type of communicable and non-communicable diseases. Let me, share with you the outcome of some of the previous policies which has been implemented at the UAE, which really helped us in saving humans' life, longevity, and also the money. Those are the four main national plans which prevented NCDs at the level of United Arab Emirates. And this will support humans' longevity and the best lifestyle to be provided. National CVD Prevention Plan, National Diabetes and Obesity Prevention Plan, National Cancer Prevention Plan, which it has been taken in this summit very strongly given care, and National Tobacco Prevention Plan. And this led to prevent almost 32,000 number of deaths and added 221,000 healthy life years. And we have been saved almost 20.4 billion UAE dirhams. Now, to do that, we had to do a lot of research and developments, and we concentrated long time back on research and development. But since 2017, which the National R&D Higher Committee was established at the level of the country, including R&D committee, ethics committee at each single health authority, and also the one at each single governmental and the private hospital. This led, since 2017 until today, that the number of research was performed, it was just 6,000. Today I'm speaking to you, it's almost, we reach 14,000 number of the research and development performed among different governmental and the private hospital, managed between all health authorities. And we work as an ecosystem, that those R&D's research was done with huge number of hospitals spread on the right side of this screen among different countries all over the world. And by the way, the people were speaking about the clinical trials today. Earlier, UAE were concentrating almost before COVID on the clinical trial phase 3 and 4. But since COVID onwards, the clinical trial has been given the priority to be concentrated as preclinical trial and clinical trials, phase 1, 2, 3, and 4. If I will speak to you on the second pillar of the initiative of the government, We, the UAE 2031, is the innovative introduction of the innovative healthcare services and technologies to the UAE. This is an example that how much we went into new innovations which supported the medical tourism. And there was great efforts from the government of Abu Dhabi and government of Dubai, in which recently the government of Abu Dhabi has been ranked 9th out of 46 destinations all over the world in medical tourism, and Dubai has been ranked 6th out of 46 destinations on the medical tourism, which we as a UAE, and mainly Abu Dhabi and Dubai, was one of the best among the region. And on the right side of the screen, you will see that the number of the people, the patient, which traveled all the way from different countries, different regions, globally to Dubai to get their treatment. And we are looking forward that UAE to be a global destination for specialized care. The other part of the initiative was the technology. And the technology, I'm quite sure you heard of Riayati, which was launched a couple of years back, and it was launched during the Arab Health 2022, January 2022. Riayati, it's a medical unified record, which is a unification of the patient's file. Now, through Riayati, we are working very strongly in the use of the big data and how we will be able to do studies and using AI and how to predict and to prevent different types of the disease and to study where the disease is moving from where and to where and among which nationalities, among which communities. We will be able to save a lot of money. Saving a number of images is being performed for a single patient who moves from a hospital to another hospital, saving the number of the diagnostic tests, saving efforts, saving costs, and really it will help in doing providing quality of care to our patients, and the life cycle of the patients will be well supported and focus on the data quality and also the disease prevalence among different communities in United Arab Emirates. This has been connected recently with the AI, and recently we have been driven the informations into the reality that we established the AI-driven Health Information Center and the Ministry of Health and Prevention. Now it's a PPP project. We are managing with one of the most reputable private company that how we will be able to use the AI in analyzing the big data, how we'll be using the AI and minimizing the number of medical errors, and how we will be able to use the AI in supporting our customers and the licensings, and even to understand where we need the hospitals to be allocated, where we need the medical centers, which kind of specialties we need to be provided, which kind of units at each single hospitals to be provided, and where we do stand in number of beds, number of the units, and number of the specialties being provided at the level of the hospitals in the United Arab Emirates. Ladies and gentlemen, I always conclude my presentation with the vision of the government of United Arab Emirates. And allow me to conclude that this prosperity and progress and the success came out by the grace of the Holy Allah, the Holy God, and after that is by the support of our government, our leaders. And this was the vision of Sheikh Mohammed bin Rashid Al Maktoum, Vice President, Prime Minister, ruler of Dubai, in which he stated very beautifully that the future belongs to those who can imagine, design, and execute, but it doesn't belong to something that to wait for it, but we need rather to create. And therefore, we need to do that. Thank you very much.